Welcome to our guide on best practices for using Firstnet within the Oracle Millennium electronic patient record. Let's ensure we provide the best care by following these essentials. At the start of your shift, always check in. This helps keep track of your responsibilities and patient assignments. You should first assign yourself to the patient. Then open the patient's notes. When you open the patient's notes, don't just click through any alerts. Take the time to read the boxes. These alerts contain crucial information for patient care. The accessibility alert can be completed in 2 clicks for the majority of the patients. The sepsis alert will fire when you open or when you close a patient's notes if it has not been de-escalated. If you do not know the patient and are about to go and review them, then you should click the review button. When you open the notes of your first patient of your shift, you should check that you are looking at the right view. If you're working at Blackburn, you should choose the emergency department view. If you're working at Burnley, you should choose the urgent treatment centre or minor injuries view if you are at Accrington. It is possible to right-click and to set that as your default view for the rest of your shift. When you are in the patient's record, you should use the components on the left-hand side of the M page effectively. This includes the history of presenting complaint, examination findings, putting in a structured diagnosis, ensuring you use the ECDS SNOMED codes. You can also record home medications quickly and easily. If a person has no regular medication or you are unable to obtain the information, then this is simply a matter of ticking these boxes. If you wish to add a medication, and you click the Add button, many medications have already been pre-built as order sentences to make this easy for you. You can add multiple medications at once. When recording somebody's past medical history and their current working diagnosis, you should use the diagnosis and problems component. Their working diagnosis should be coded within the emergency care dataset. If the person has no past medical history, then you can simply click No Chronic Problems here. If they've previously had problems coded on Millennium, they will appear here and you can simply mark them as reviewed. If you wish to add a chronic problem, then you can do this here as well. If you have recorded a diagnosis in a structured format, you should find that it appears in your plan component for you to write your specific plan and actions that relate to that diagnosis. If you want to prescribe any treatment, then you should go to the Quick Orders tab. Here you will find some common requests within the emergency department. You can also set your own favourites. You should try and use power plans for your prescribing, such as the TTO power plans, pneumonia and DKA. You can multi-select orders with incomplete details by pressing the control button. You will notice that these orders are now appearing in the Plan and Requested Actions component. You should generate the clinical note at the time you see the patient, not when the investigations are complete. You can then modify, adding an addendum to the notes as results become available. At the end of your shift, you should also create an ED handover S-bar note. This should include any outstanding jobs and the name of the person that you are handing over to. At the end of your shift, you should check out and reassign all your patients to ensure continuity of care. I am now going to switch patients to show you what to do with a patient who you are discharging from the emergency department. To do this, you will use the ED discharge workflow or the Urgent Treatment Centre discharge workflow end page. You should complete all the components on the left-hand side just the same way as you did using the clinical information end page. If you want to prescribe medication for somebody who you are discharging, there are power plans that match the stock in each of the TTO cupboards in the trust. This ensures that you are prescribing something that the nursing staff will be able to easily dispense from the cupboard. When you are prescribing a medicine that will need to be dispensed, you will see this box pop up. The correct answer is yes, you wish to generate an ED prescription. You will see this form for any medication that needs to be dispensed. It is important that this form is filled in accurately to allow our pharmacy colleagues to complete their workflow. Please also make sure that any contact number is accurate. Every patient needs their discharge workflow completing. This is the coding of the patient. Only patients who are leaving the hospital site that you are currently on will need a discharge letter creating. Please make sure that you choose the correct discharge summary for the site that you are on, as this will allow the correct contact information to be sent to the GP. Filling in the treatment form accurately allows us to show the commissioners and other people how busy we really are and how hard we all work. The discharge information form populates the top of the discharge letter, and so it is important that this is accurate so that the correct information is sent on to the GP. You will also notice that if the patient has attended with an injury, then you will be asked to complete the injury characteristics and victim of assault form. You should use the clinical narrative to write a short synopsis of what happened while the patient was in the department. You should then check that any results have been endorsed. Create your discharge summary. Read it to be sure it makes sense before then signing it. Remember, a good discharge letter is clear and concise, contains only the relevant information that the next clinician looking after the patient will need to take over their care. At the start and end of each shift, you should also access your message centre to endorse any results for patients that you have requested in this shift or previously. By following these best practices, we can ensure efficient and effective use of Firstnet within the Oracle Millennium electronic patient record, ultimately providing better care for our patients. Thank you for watching.